Dr. Paul here. We have got the most impressive warts I think we have ever seen. Ha! Hey, how you guys doing?
Good, how's it going, Dr. James?
I was like, if I get to see Noah, then yeah, we'll sign our rights away.
Oh, look at that.
How are you?
Good, how are you?
So where do I?
Oh, you just signed there. We're here for two things today. One is you can probably tell that this foot is a bit red and it's swollen. Now, this young man, for his own other reasons, which we're not covering today, sometimes has a little bit of edema, which is just swelling in the tissue. It's not too bad today, really. But this is redness and this foot is hot. I mean, warm. Yeah, definitely warm compared to the other foot.
Oh, that burns.
What we are also going to see
That
here
burns.
are, do you need light or are we good?
Oh,
We're good?
That
All right, we're seeing some fairly impressive, what are those, guys? The viewers probably know. That's a wart. That's a collection. That's a pretty huge area there. We've got more over here. I think there's, look to this foot here. You can see warts on all these toes.
Poor guy.
Yeah. And does he have warts anywhere else on his body?
Up his legs.
Okay, a little higher up.
Yeah.
So I think we'll focus on these. The interesting thing about wart treatment is if we, while you get some pictures of those warts, I'm going to get some numbing cream. We'll get a little numbing cream on there. We get some close-ups, and then we'll come back a little later. So an interesting side note, you might be wondering, why are these warts clustered on his feet? And I would say because this young man has some other issues with circulation to the lower extremities. His immune system probably is not as robust in the areas that have less circulation. And so therefore, the warts are going nuts on his feet and toes. We're just gonna put some numbing cream. This is just lidocaine, prilocaine, 2.5%. Does not hurt one bit. So we'll get a little bit of this on the ones that we're gonna freeze. What I was gonna say, is that cold? Yeah, a little bit cold. I'm just gonna spread some of that across. There we go. He's got sensitive toes. I'm just sort of squishing that on there so it'll stay. What I was gonna say is when you're treating warts, you don't have to treat all of them. So when you, in this case, we've got so many, and I can tell you from experience, having had warts on the ends of my toes and treating my wife's warts once that were on her toes, that, oh yeah, I should warn you when I'm about to do something. It hurts the worst on the ends of toes or fingers because we have so many nerve endings. So I'm just gonna treat a couple on the sides here. We'll get this other big one on this foot here. And I imagine we'll be all set. I am merely using this to keep this on there. Spread it around and keep it on there for now. So we're gonna pause 15 minutes and then we'll be right back.
A few moments later.
We're gonna go get some liquid nitrogen. 2 big ladlefuls. There we go.
We're gonna fix your owies, okay?
Good job.
Fix your owies.
Keep it working.
Keep it working.
Yeah, we're gonna keep it working. Good job.
Wow, that stuff numbed it right down. You're not even reacting. You're a super sensitive boy.
We haven't gotten to where he would feel
And
it
you're
yet.
doing, and you're doing, and you're doing, and you're doing.
All right, you're doing great. You are doing great.
Keep on.
Uh-oh, you felt it now.
Keep it in.
You felt it a little bit.
Awesome.
We'll go to a different one since you're feeling that one. Let's go to this one. Look at that monster.
Yes, very sensitive too.
I know what?
There you go, Joe. There you go, big
And don't
guy.
forget,
It's like when you stick your tongue on something
I
and
get
it
on
gets stuck.
Colette.
Yeah.
Yeah, that just happened with the threads
I
of
get on
my
the Colette.
Q-tip that's carrying the liquid nitrogen.
Sorry.
You're good. I'll work around you. I got a big enough target here.
Yeah, you do have a big target today.
What's up? I know.
There you go. We're getting it.
Doing
Yep.
good, bud.
Yep.
Doing good, buddy. We're getting it. You're such a sensitive nerves on your foot usually, so you're doing really great.
There's. I was just saying.
You're doing. You're
Felt that?
doing.
You felt it? Okay, sorry.
Now go to sleep.
That's what I say to him as
No.
well when he's bothering
Go
me.
to
Yeah,
sleep.
now you go to sleep.
You can go to sleep now.
You can leave me
As long as you
alone.
catch him after 9, he probably will be.
Yeah. You know me well. So you can see, those of you who are watching, it's kind of turning white like an ice cube. And the general goal with freezing warts is to get it deep enough that you actually hit some normal tissue. That increases blood flow to the area. But that also is what ends up hurting. So I'm going to just go for it a little bit here until he says no. Because that way we'll know we've gotten some normal tissue.
Hot and a cough. Right
I think he's
here.
feeling it.
Feel that
I
one.
think he's feeling it. We'll move on to the last one. Okay, we'll go to this one. Good job.
Good job.
You got
Way to
ticklish.
tell us.
Are you ticklish?
He's ticklish.
People are worried that I don't have any gloves on.
What is the wash?
I am a hand washer. I wash my hands before and after each patient,
This.
especially when I'm dealing with something that might be infectious. Warts aren't that contagious, honestly. I'm around warts practically every day.
That was
And
fun.
I've had warts myself once in my entire career, and they were on my toes. I don't think it had anything to do with
You want stickers?
patients. I probably caught it in
I
the
want
swimming
the
pool, maybe.
stickers.
This one's ticklish.
Yeah.
No.
That's usually really sensitive when we touch it. So
That one there?
I think the Novocaine is
I don't
Was that
have
right?
a rat.
There you go. Alright, guys.
Doing good, buddy.
You're
Better
doing,
than I'd be doing, that's for
you're doing great.
Stickers?
Well, avoiding the toe ones helps.
You're gonna get stickers, yes.
Yes, you're gonna get
You're
stickers.
gonna get stickers after this. You love stickers here, huh?
So there's a home remedy where you would apply a liquid wart medicine and just to the wart, and then make sure it's dry before you cover it with a piece of duct tape. And you would do that right before bed.
What is called?
And then in the morning, you take the duct tape off, go about your day like normal, and do it again at night. And
And
the
the rust, and
liquid
the rust, and the rust,
wart medicine
and the
will
rust.
sort of eat away at
Right
it
here on the rust.
while you're sleeping. And one of the reasons that works so well is it works until it hits normal blood flow. So when you've finished eventually eating through the wart, your normal blood flow will neutralize it, the acid, and done. So if he doesn't particularly want to come back for more wart treatments, it would be pretty amazing if one treatment got rid of all these warts. I'm guessing he would need multiple treatments, and possibly a dermatology approach where they sort of sensitize you to a
You did
some kind of agent that
tap
will
on
then
a correct.
draw the immune system to where the warts are.
kind of
No
sense to like anybody. I hope you know that.
I don't always make sense.
I mean, I feel like
gotta-
medical folk know what you're talking about.
So they use, for example, I think it's beetle juice some dermatologists will use. And
Michael Keaton or
they'll apply it on the skin somewhere else, get you reacting to it, and then apply it on the wart.
Now,
No one
don't
caught the
you
Michael Keaton?
sleep.
No, I didn't catch that.
Aaron did. Oh, we got a microphone.
Now,
play Beetlejuice.
Mom got
in
it.
the Tim Burton movie.
Oh, okay, yeah. I never watched that one.
Skip it. I mean, I loved it. You'll hate it though.
All right, he's letting us get a deep freeze right there, so we'll go for it. All right, we'll call it good.
Yeah, that was amazing.
We got 3 big warts out of the collection.
Yeah.
We have a family here, and we're going to take out the big daddy and the big mama, and maybe we'll get the immune system going so well that everybody else just goes, I give, surrender, I'm out. And there you have it. Dr. Paul, thanks for watching. Big thumbs up for this brave young man who let us do
job,
this.
bud.
All right,
Bud.
man. High five. Good job. All right. Oh, you get to watch this. There's still some left.
Look down there. Made a cloud.
Whoa. Amazing.
Where'd it go?
I am going to wash my hands after. I did it before, too. Yeah.